overturned by the Supreme Court, which seems rather likely, then what? What happens to this attorney?
So there was this fun editorial, and actually they ran it in the Denver Post. I had run it in the Chicago Tribune. The issue is, can you force an American citizen to purchase a product? And that's the whole Commerce Clause argument that's being argued in the courts around this. And a lot of people agree with you that the court, that if you went to our current Supreme Court, which is predominantly conservative, that they would say, no, you can't do that. What's interesting is that the federal government does have a right to levy taxes to pay for health care for the population.
Yeah.
Because they can put this in as a part of the basic health care. So I like to tease that they're going to sue us all the way into single payer. But who knows how that will play out. Because the truth of the matter is, how many people are willing to say, I want you to get rid of guarantee issue. I want you to get rid of discrimination. I want you to put back discrimination, to allow rescission, to let insurers deny you care and deny you access to health insurance. I don't think many people will buy that. And insurers are not willing to do that without the mandate. So I think they're backing themselves into a corner that it will be interesting to see how they pull out of. The bigger concern for me is if they don't fund it, is that now you have this federal law that says that you have to provide Medicaid to everybody at 133% of federal poverty level.
Without
How do you
raising
fund
any
that?
funds for Medicare.
That means that there's even less money for Medicaid. And so what Medicaid pays is much less, and what they cover and pay for is even less. And so that's my concern with that. I don't know. I think sometimes the Republicans do things to say they do it, but don't really think it'll happen. But I'm a little worried that they're going to back themselves in a corner with this Supreme Court thing. And then we'll just have to have Medicare for all.
That would be good.
How do you deal with the influx of people from other states then?
What it would be is that you would have to have some proof of residency in the state of Colorado to be part of the system, and then it would just be like when you go on vacation somewhere else, you're going to get a bill for your care if you come into our system and you're not one of our residents. In the design we had a couple of years ago, it talked about having a minimum residency requirement of like 90 days or something. There will undoubtedly be people who lie and cheat to get in here, and you'll just have to monitor for that.
I know that you're carrying an ID bill also, a continued extension of the identification theft issue.
Oh, I am not, but is the...
Aren't you co-sponsor, signed on as a sponsor?